Ladies and gentlemen, a very warm welcome to the delegates from the entire Delta Healthcare team. We deeply appreciate the tremendous response we have received for this event and are confident that you will find today's program insightful and engaging. Before we begin, here are a few important points to remember. Regarding queries, due to the large number of participants, one-on-one interaction might be not feasible. Please post your questions in the chat box as they arise. There is a chat box in the side of your Google Meet window. We will try to address them immediately, but any unanswered questions will be taken up during the Q&A session at the end. Regarding pricing information, we will provide approximate costs for our products wherever possible. Detailed pricing tailored to your specific requirements will be sent later. Please fill out the inquiry form at the end of the session. Now let's get started. Allow me to share my screen. I am your host for today, Manali Gole, Regional Head at Delta Healthcare. We are currently hosting from Bhailal Amin General Hospital, Vadodara, and we would like to thank the management here for allowing us to stream this event. This is one of its kind lab designed by Delta Healthcare for Bhailal Amin Hospital. We will be taking you through the entire lab. There'll be a virtual tour of this lab for you to get an idea. It is my pleasure to introduce our key speaker, Mr. Rahul Bisht, the Chief Simulation Educator at Delta Healthcare. Mr. Rahul has over 10 years of experience in simulation-based education. So Rahul will be taking care of the demonstration and the entire product range basically. So I'll be sharing my screen now. If it is not visible to you or you have any issues, kindly put it down in the chat box. So this will be today's agenda. After welcome and introduction, we'll be giving a brief introduction of Delta Healthcare, who are we. We'll be talking about NCISM guidelines regarding Yogya Skills Lab requirements. We'll be demonstrating the products as per the minimum essential requirements that are mentioned in the guidelines. We will be taking you through a virtual tour of the existing skills lab, and we will be also showing you one more skills lab, which we have a state-of-art skills lab that we have developed. And then we will be talking about the phase-wise implementation. Okay, and then we'll take you through the. I mean, you'll asking the questions, and we'll try to answer as many as possible. So let's begin. So regarding Delta Healthcare, so who are we? Okay, we are Delta Healthcare, and we are established in 2010. We are specialists in skills and simulation labs. So we have an extensive product range of more than 1,500 products. We have global partnerships with industry leaders from Germany, US, Canada, Australia, UK. Okay, and so basically, we've been into this industry since last more than 13 years now. We are a process-oriented company, which makes the overall procurement procedure quite smooth. What we do, we are not just a supplier of simulators or mannequins, but we are a solution provider. We are a one-stop solution. So we provide you everything right from scratch. You just think of, you just have a place and you want to develop your skills lab in that particular place, your institution skills lab. We will guide you right from the layouting. Sorry. So we will guide you right from the layouting of the lab, designing of the lab, how exactly it has to be placed, where has to be the demo room, where has to be the practice room, as per the guidelines. We provide you the products, we demonstrate the products as per your budget. We make your, requirement document. Post that, post the installations, we not just give you the installation and product training, but we do a proper hand holding for your faculty till they get settled. Okay, so we provide workshops, we provide train the trainer programs for you. And post the installation, so basically we provide 6 years warranty for all our products, and we see to it that we visit you at your premises twice a year for the maintenance checks. In the skill lab, mistakes are lessons, practice is perfection, and proficiency is forged. It's where the art of healing begins. So today, in this session, we are not just going to talk about what the mandate requires, but we are going to talk about the importance of skill labs for your particular institute, for any medical institute for that matter. So this is our growth timeline. Since we started in 2010, we initially it was customer references, developing different skill labs. So since 2018 to 2022, we have developed state-of-art skill labs across India. One of which is Pragya Simulation Center, which you must be aware of, the simulation lab of Parul University, which is said to be one of the best skill labs across India, which was one of our major milestones. Then we have also collaborated with esteemed associations like Trained Nurses Association of India, who has, with Delta Healthcare, along with TNI, we are developing various skill labs across India. So Delta Healthcare is spread across 14 plus states now. We have more than 500 installations across India, 24 plus channel partners, and 1500 plus products in our kitty. I have explained you the work process, but we will go through this in detail later. Innovation must be measured by its impact. Simulation-based trainings must be measured by the number of lives saved after training. So as I said previously, and even my colleague Rahul will be taking it ahead, that today we are meeting not just for what is required and what is mandatory, but the actual use of this particular simulation lab in the life of your students, your institution. So let's take this session ahead and talk about the NCISM requirements that are mentioned in the guidelines. I assume all of you must be having this particular document. If you don't have it, kindly mention it in the chat box. We will be sending this document PDF, entire document, in the WhatsApp group later. So in the mandate, clause number 20, page 123, where they have mentioned, where the council has mentioned the exact requirement, wherein models, mannequins, VR, AR teaching, storage facility required for the lab, office space, demo and practice rooms that will be required in the lab. So basically, what exactly are the requirement of the lab has been mentioned. So you need not worry about it. So if in case, so basically as I said earlier, we provide the layouting of the lab as such. So all inputs can be provided by us when it comes to um, the requirements of clinical skills lab. So again, they have also mentioned that as per the intake capacity, I'm sorry, as per the intake capacity, the room area has to be specific room area is mentioned. Say, for example, your intake capacity is 100, then your minimum area required for your skills lab is going to be 200 square meters, in which 100 square meters is going to be common area, and two areas divided into 50 square meters each, one for the demo room and one for the practice room. So depending on the intake capacity of your college, you will have to allocate a space for this particular lab, which will have a common area and a demo and practice room. It will also have office spaces for the coordinators and the administrative staff as well. It will also have storage facility, because not every time the simulators are going to be in use. So when they are in use, they'll be kept on the table or bed or whatever. And when they are not in use, they have to kept in the storage facility. So entire requirement has been jotted down nicely. On page 154, 155, it is mentioned about the phase-wise implementation. So we will also, once we show you the products, you will get a better idea of how the phase-wise implementation has to be done. So they have mentioned about the phase-wise implementation, as in first phase, they want you to consider the first professional subjects. Okay, so the first professional subject related products have to be bought in first phase, in case you're going for phase wise implementation. If you want to take it up entirely together, then it is fine. But otherwise, if you want to break this entire period into 3 phases, then you will have to consider first professional subject first. In phase 2, you will have to consider second professional subject, and in third, you have to consider the third professional subjects. Page 174 onwards, schedule 15, they have clearly mentioned the required products. So basic, the basic simulators, and so basic simulators for all the departments, which is BLS and ALS, the basic life support and advanced life support, which will be throughout the departments. These will be required throughout the departments. Okay, and so basically, first phase, you will have to go for BLS, ALS, and first professional subject, that is Kriya Shairya. So in Kriya Shairya, you will have to go for chest auscultation trainer and ECG trainer. So this is what is required for phase 1. For phase 2, you will have to go for the second professional subject, which is Roga Nidana, and so on. Roga Nidana and Agada Tantra. So in Roga Nidana, the products that are mentioned are nursing trainer for decubitus, chest auscultation trainer, and IV arm. Blood sampling trainer, which is nothing but IV arm. Agada Tantra, there is no such product as such. There is only documentation and legal documentation stuff. So there is no product as such, which can be provided in Agada Tantra. Third professional subjects, there are a number of products. So once you see the products, you will get a better idea of what exactly is your phase 1, phase 2, phase 3 going to look like. Okay. There might be chances that you club 2 phases and go together. Also, there are few products which just one product will have n number of skills. So we have one product which is a whole body mannequin, which has more than 20 skills in it, and these skills are spread across the departments. So you can buy one, and it can be used across the departments, because they have mentioned that any particular simulators or mannequins that you buy can be used across the departments as well. There is no requirement of buying separate set of products for every department. It can be clubbed together. So all these products we will be going through one by one in the next session. So with this, I would like to hand over the presentation to my colleague, Mr. Rahul Bisht, who will be taking this ahead, and I will mute myself. Thank you so much. If you have any queries in the standards, kindly put it in the chat box. We will take it up later. Thank you.
आज आज तुमने अभी देखा बता वहाँ पर कोई है
Rahul, you are not audible. Rahul, you are not audible.
वहाँ से
Just give us a minute. We'll be back.
Audible? So, sorry
Yes,
for the
you're audible.
disturbance. Sorry for the disturbance. A very warm good afternoon to one and all present over here. This is Rahul Best. So in this, I'm going to tell you about the different mannequins which is required in your profession in the Ayurveda department. So as you know, there are different departments in your profession. For example, like Kaya Chikitsa, Kriya Sharira, Yoga Roga Nidan, Panchakarma, Prasuti and Sri Rog department. So we are going to discuss about the different mannequins which was required in your profession. So we'll take you one by one, what all are the mannequins which was required by your setup. So first we are going to discuss about the Kaya Chikitsa department. In Kaya Chikitsa department, these are the specific mannequins which was required by your department. So one by one, we are going to teach you what all procedures you can able to perform in these mannequins and how you are going to operate the mannequins. So as you can see, these are the mannequins which is required for the Roma procedure. Roma procedure means that is routes of medication administration. ऐसे रूट्स जहां से आप मेडिसिन को एडमिनिस्टर कर सकते हो. फॉर एग्जांपल हमारे पास डिफरेंट रूट्स हैं जैसे कि आईएम, IV, subcutaneous, intradermal. So these are the mannequins are responsible for the administration of the medication. So the first is about the IV route. IV means that we have, with the help of the IV, we are going to administer the medication or we can aspirate the blood sample. So this is known as the IV arm. The IV arm will resemble the human anatomical structure, means this particular structure will able to resemble the real human hand because the anatomical structure is same as a real human hand, as well as you will be able to find a different veins which is basically present in the patient itself or in the human being itself. So here you can see there are the different veins like cephalic, basilic, accessory cephalic, mid basilic. So these are the veins which is responsible for the aspiration of blood sample, as well as we can able to insert the cannula, and what we can do is we can able to administer the medications with the help of this IV arm. So here you can see this is a bottle, and this bottle is basically filled with the artificial blood, and then the whole blood will goes inside these particular veins, and with the help of this we can aspirate the blood sample. So it will gives you a real essence of the aspiration of blood sample as well as the administration of the medication. So now I'll show you how you are going to aspirate the blood sample. किस तरीके से आप blood को aspirate कर सकते हो. So you have to palpate any vein and you are going to insert the needle. So when you are going to insert the needle, you have to insert the needle and you can aspirate the sample. So with the help of this, you can able to aspirate the sample. Along with this, what we can do is in this mannequin, you can go with the aspiration of blood sample. Either it is a routine sample or culture sample. Because कई बार ऐसा होता है कि आप लोग स्टाफ को बोलते हो कि आपको कल्चर सैंपल लेना है. फॉर एग्जांपल स्टराइल वे में सैंपल लेना है, तो आप स्टराइल वे में भी सैंपल इसमें कर ले सकते हो. आपको रूटीन सैंपल देना है वो भी हम कर सकते हैं. साइड बाय साइड आप इसमें IV कैनुला जो हम इंसर्ट करते हैं फॉर द एडमिनिस्ट्रेशन ऑफ द ब्लड कंपोनेंट, आपको ब्लड ट्रांसफ्यूजन करना है, वो भी हम इसमें with the help of IV cannula we can administer the blood sample, this one, that is your blood transfusion. और in case हमें कोई ऐसी medicines हैं जो IV route के form में देनी है, तो these medications also we can administer with the help of this particular IV arm. So these in one mannequin you can able to perform a different numerous procedures. So this is all about the intravenous or we can say IV arm. So next we'll move towards the next one. So this is known as your deltoid injection trainer. So with the help of this mannequin, you may able to administer the IM injection. इसके थ्रू आप क्या कर सकते हो, IM injection जो है वो administer कर सकते हैं. और ये जो है, this is basically your that is feedback device. इसमें आपको feedback मिलेगा किस तरीके की जो बच्चा है वो सही जगह इंजेक्शन लगा भी रहा है कि नहीं लगा रहा. इसमें एक लाइट ब्लिंक होती है. फॉर एग्जाम्पल, अगर बच्चे ने गलत जगह इंजेक्शन लगाया है, that means there will be a blinking of a red light. If it is in a correct area, there will be a blinking of a green light. So this device is basically used as a feedback device, and you may able to get a feedback from the participant side whether he has administered the IM injection in the correct area or not. So I'll show you how you are going to administer the IM injection and how you are going to get the feedback. So there is one button which is known as the on and off button. So with the help of this button, the mannequin will get on, and after oning it, now we are going to inject the needle, and here you can see there is a blinking of a green light. That means I have administered the injection in the correct area. So this is how this particular mannequin, or we can say that is intramuscular trainer, works. And as we already know, there are different routes of administration of the intramuscular injection. So for example, there is a deltoid muscle. So this particular mannequin represents the deltoid area of your body. So you can able to tie this with the help of this belt, and you may able to administer the IM injection, and it will gives you a real essence of the administration of the IM injection. So next we'll move towards the next mannequin, which is also known as the intramuscular injection trainer. But this one is basically for the buttocks injection, because with the help of this one, you can able to administer the injection in the buttocks area. As everybody knows in the medical profession, either we can administer the IM in the deltoid muscle or we can inject in the buttocks area. हम buttocks में भी IM injection लगा सकते हैं, because there are different routes. It is your ventrogluteal, dorsogluteal, vastus lateralis. So we can able to administer the IM injection with the help of this buttock root also. So what we have to do is, we have to take a syringe, and we can clean the area, and you can administer the injection 90 degree, and you can push the medication inside this particular mannequin. So with the help of this one, you may able to administer the IM injection. Next is about the intradermal. So this particular aspect will represent the anterior aspect of your this particular arm, because everybody knows intradermal, that means we have to administer the injection in the dermis layer. So dermis layer is basically the superficial layer of the skin. So this mannequin will represent the superficial layer of the skin, and we can administer. What you can do is, you can take a 0.5 ml of solution, or you can say a medication, and you can administer in the dermis layer. और उसमें जैसे हमें मच्छर काटता है ना, उस तरीके का एक पट्टी बन जाएगा. दैट मीन्स आपने क्या किया है, जो मैंने आईडी इंजेक्शन दिया है वो आपने सुपरफिशियल स्किन पे दिया हुआ है. वो हम क्यों करते हैं, बेसिकली जैसे हाइपर सेंसिटिविटी रिएक्शन को चेक करने के लिए. उस टाइम की जो मरीज है वो उस पर्टिकुलर ड्रग के हाइपर सेंसिटिव तो नहीं है. दैट्स व्हाई वी यूज टू एडमिनिस्टर द इंटरडर्मल इंजेक्शन इन द डर्मिस लेयर ऑफ द स्किन. So now what we are going to do is, this is all about that is your different injection mannequins, or we can call it as a Kaya Chikitsa department, because these mannequins may require in the Kaya Chikitsa department. Now we will move towards the next station, where I'm going to show you the different mannequin which is widely used for that is your Shalakya Tantra. So these are the two mannequins. These mannequins are ideally used in case of the Shalakya Tantra department. These are known as the catheterization model. Catheterization, because as in your mandate itself, it is required that you need the mannequins where you can able to perform a बस्ती procedure. जैसे कि आपके डिपार्टमेंट में एक प्रोसीजर कहलाता है जिसको हम बस्ती बोलते हैं. बस्ती में आप तेल का यूज करते हो या कुछ मेडिसिन का यूज करते हो. तो जो ये कैथेटराइजेशन मॉडल्स हैं, इसमें आप जो आपके डिपार्टमेंट का बस्ती का जो प्रोसीजर आता है वो आप इसमें परफॉर्म कर सकते हैं. ये कैथेटराइजेशन मॉडल आपको दो में मिलते हैं, जिसमें एक फीमेल कैथेटराइजेशन और एक होता है हमारे पास मेल कैथेटराइजेशन. इसमें अगर आपको हम दिखाएं तो इसमें आपको मिलेगा एक ट्रांसपेरेंट ब्लैडर. So this will be a transparent bladder, और ये चैम्बर को आपने आर्टिफिशियल यूरिन से फिल करना होता है, and then the whole urine may accumulate into the bladder itself. And what we can do is, we can insert the catheter with the help of the opening. And in female also, you have to separate the labia majora and minora, and you can able to insert the catheter. आपको पता होगा कैथेटराइजेशन हम यूज करते हैं, जो जिन लोगों का यूरिन पास नहीं हो पाता उनके लिए भी हम कैथेटराइजेशन यूज करते हैं। आपके डिपार्टमेंट में आप बस्ती के लिए इनका यूज करते हो। तो जो ये दोनों मैनिक्विन है, इट मे रिजेंबल एंड इट मे गिव यू द रियल एसेंस ऑफ द रियल ह्यूमन एनाटॉमिकल बॉडी पार्ट्स। बिकॉज आपको पता होगा, जैसे कि मेल्स की हम बात करते हैं, मेल्स में जो फोर स्किन होती है उसको हमें पीछे की तरफ खींचना होता है। इस मैनिक्विन में भी आपको फोर स्किन मिलेगी जो आपको एक रियल एसेंस देगी, और इस फोर स्किन को आप नीचे की तरफ क्या है रिट्रैक्ट कर सकते हो, एंड दोबारा से इस फोर स्किन को आप ऊपर की तरफ रिवर्ट बैक भी कर सकते हो। तो इसमें हम कैथेटराइजेशन प्रोसीजर, और हमारे पास जैसे कि इरिगेशन करना है, आपको पूरा बेडर जो है वो आपको साफ करना है, वो भी हम इसमें कर सकते हैं। So this, as per your profession or either department, you can able to perform the Basti procedure mainly, and you can go with the catheterization procedure with the help of these two particular models. Now, next we'll move towards the next one, that is a suture models. So this is known as the suture arm, and this one is the suture pad, where you can, or your students can able to practice a different minor suturing procedure. So here you can see this is a suture pad, and this one is the suture arm, where you can go with the difficult suturing, or where you can perform a, that is your normal, or we can say this is a simple suturing. So what we can do is, इस पूरे arm में, इस पूरे arm के अंदर, this arm is made up of a silicone, and it will gives you a real essence of the real human hand, and you may able to feel the कि आप सच में किसी पेशेंट का, किसी मरीज के जो है सूचरिंग परफॉर्म कर रहे हो। वो कैसे, इसमें हम लोग एक इंसीजन करेंगे, और एक इंसीजन में आप अप्रोक्सीमेटली 100 टाइम्स जो है वो सूचरिंग का प्रोसीजर जो है वो आप कर सकते हो। अब इस पूरे हाथ में हम कितने इंसीजन कर सकते हैं? इस पूरे हाथ में आप मोर देन 20 और 25,000 इंसीजन परफॉर्म कर सकते हो। 20 से 25,000 हम लोग इसमें चीरा मार सकते हैं, और एक चीरा लगाने पे आप अप्रोक्सीमेटली 100 टाइम्स सूचरिंग कर सकते हैं। फॉर एग्जाम्पल, जैसे कि आपके पास 60 बच्चों का बैच है, 60 बच्चों के बैच में अगर आपने एक बार इंसीजन कर दिया, एक बार चीरा मार दिया, तो उस एक चीरे में आपके सारे स्टूडेंट जो हैं इसमें पूरा जो सूचरिंग का प्रोसीजर है वो परफॉर्म कर सकते हैं। अब वो कोई भी टाइप की सूचरिंग हो, फॉर एग्जाम्पल वेदर इट इज योर कंटिन्यूअस सूचरिंग, इंटरमिटेंट सूचरिंग, फिगर ऑफ 8, या फिर आपके पास अनइंटरप्टेड सूचरिंग, मल्टीपल सूचरिंग प्रोसीजर्स वी कैन एबल टू परफॉर्म इन दिस particular that is your suture arm. A suture pad, you can able to perform a simple suturing. So what we can do is simply you can make an incision and you can perform the suturing procedure with the help of the suture pad also. So these are the specific characteristics of these particular models. These models you are using ideally in case of the Shalakyatantra, and these are basically prescribed for the suturing procedure, which is ideally known as a minor suturing procedure. So now we'll move towards the next stations, where we are going to discuss about the Roga Nidan, or we can say Kriya Sharira department. So now we are having a two mannequins. So these two mannequins are ideally used in case of the Kaya Chikitsa or the Kriya Sharira. आपके पास जो दो डिपार्टमेंट है, काया चिकित्सा डिपार्टमेंट एंड क्रिया शरीरा डिपार्टमेंट, उन दोनों डिपार्टमेंट में हम ये दो मैनिकिन का यूज करते हैं, जिससे हम बोलते हैं BLS का मैनिकिन। अभी क्या है, हमारे यहाँ पे कुछ नया मैंडेट भी आया हुआ है, नर्सिंग हो, पैरामेडिकल हो, मेडिकल हो, या आयुर्वेदा हो, होम्योपैथी हो, यूनानी है, सिद्धा है, हर डिपार्टमेंट में हमारे कमीशन लागू हो चुके हैं। और कमीशन ने क्या बोला है कि आपके पास स्किल लैब का होना कंपलसरी है, और साथ साथ में यूजीसी ने ये भी मैंडेटरी कर दिया है कि हर एक ग्रेजुएटेड कॉलेज के पास कॉलेज को हमेशा BLS सिखाना ही है। तो चाहे वो आयुर्वेदा में हो, चाहे वो नर्सिंग में हो, चाहे वो डिफरेंट डिग्री कॉलेजेस क्यों ना हो, या सिंपल बेसिक कॉलेजेस क्यों ना हो, वहां पे हमें क्या है बेसिक CPR जो है वो सिखाना है। बिकॉज कार्डियक अरेस्ट कभी किसी को बोल के नहीं आएगा, तो वो जो प्रैक्टिस है वो कहाँ से आएगी? विद द हेल्प ऑफ दिस मैनिकिन, क्योंकि हम रियल पेशेंट पे हर किसी को मौका नहीं मिल पाएगा। तो उस चीज का एसेंस फील करने के लिए हम क्या कर रहे हैं, इन मैनिकिन पे वो प्रोसीजर्स को हम परफॉर्म कर रहे हैं। क्यों? क्योंकि होता क्या है, काफी सारे कॉलेजेस में हर एक बच्चे को चांस नहीं मिल पाता हर एक प्रोसीजर करने का। तो उस चीज को रिड्यूस करने के लिए ये मैनिकिन्स बने हैं, और इन मैनिकिन्स में हर एक बच्चे को चांस मिलेगा, जो चीज वो अपने क्लिनिकल्स में नहीं कर सकता वो इन मैनिकिन्स में कर सकता है, सो दैट ही मे एबल टू फील द रियल एसेंस ऑफ दोज पर्टिकुलर प्रोसीजर जो उसने अपने क्लिनिकल्स में नहीं किए हैं। तो यहाँ पे हमारे पास क्या है, दिस इज नोन एज दी, दैट इज अवर BLS मैनिकिन, और वी कैन से हाफ टॉर्सो मैनिकिन। ये हमारा फीडबैक डिवाइस होता है, जिसमें हम लोग क्या करते हैं, हमें फीडबैक मिलता है कितना हम कंप्रेशन कर रहे हैं, कितना आप इसमें पेशेंट को मुंह से सांसें दे रहे हो, वो सारा इसमें हमें शो होता है। इसमें आप कंप्रेशन कर सकते हो अच्छे से, जितना आपको डेप्थ मेंटेन करना है वो सब आपको एक फीडबैक डिवाइस में मिलेगा। इसके साथ साथ इसमें क्या है कि एक फीडबैक डिवाइस होगा जो आपको अपने फोन में इंस्टॉल करना पड़ेगा। फ्री ऑफ कॉस्ट डिवाइस होता है, एक ऐप होता है जिसको हम बोलते हैं CPR एड ऑन किट इंस्ट्रक्टर ऐप। उस ऐप को आपने डाउनलोड करना है और उस ऐप के थ्रू आपका कोई पैसा खर्च नहीं होगा, सिर्फ वो ऐप आप डाउनलोड करना है। उसमें आपको बस अपने जो बच्चे की परफॉर्मेंस है कि वो किस तरीके से हाउ ही और शी इज परफॉर्मिंग द बेसिक CPR, वो आप उस ऐप के थ्रू देख सकते हैं। सेकंड हमारे पास दैट इज द इन्फेंट CPR मैनेकिन। इन्फेंट CPR मतलब जब बच्चा हमारा 28 महीने से 1 साल का होता है, उसको हम इन्फेंट कैटेगरी में काउंट करते हैं। इसमें आप सिंगल रेस्क्यूअर CPR या डबल रेस्क्यूअर CPR, या तो आप इसके अंदर 2 फिंगर टेक्निक फॉलो कर सकते हो, या आप इसके अंदर इन सर्कलिंग टेक्निक हम क्या है फॉलो कर सकते हैं। तो ये हमारे लिए हो गया, इट इज बेसिक pediatric CPR mannequin। इसमें आपको फीडबैक नहीं मिलेगा, but only you can perform a basic aspect of a CPR procedure which we may use to perform in case of the pediatric. So these two mannequins are ideally used in case of the Kaya Chikitsa and the Kriya Sharira department. So now we'll move towards the next department, which is known as the Kumar Bhatya department, that is the pediatric department. So these are the mannequins which is basically used in case of the Kumar Bhatia department or the pediatric department. So here you can see we do have a multiple types of department. So here, so this one is the premature baby. Premature means जब बच्चा हमारा 9 महीने से पहले पैदा हो जाता है. So this is basically a premature baby where you can able to perform a different procedure. तो यहाँ पे हम लोग बहुत सारे प्रोसीजर जो है इसमें परफॉर्म कर सकते हैं। इसका वेट भी हमारा 2 kg से बहुत कम का है, क्योंकि इसको हमने प्रीमेच्योर बोला है। अगर हम नॉर्मल एक हेल्दी बेबी का वेट काउंट करते हैं तो वो 2.5 और 3 kg के अप्रॉक्स, बट इसका वेट जो होगा आपका ये 1 और 1.5 के अप्रॉक्स का होगा, इसीलिए इसको हमने प्रीमेच्योर बोला हुआ है। इसमें आप इंट्यूबेशन कर सकते हो, इसमें नेजल ओपनिंग है जिससे आप एनजी ट्यूब इंसर्शन भी कर सकते हो, यहाँ पे अम्लाइकल कॉर्ड है जिससे आप अम्लाइकल कॉर्ड केयर कर सकते हो। साथ ही साथ में यहाँ पे आपको इसके अंदर डिफरेंट हमारे पास एनजी ट्यूब इंसर्शन, इंट्यूबेशन, जिसमें आप बेसिक एयरवे, एडवांस एयरवे इंसर्शन, ये सारे प्रोसीजर हम इसके अंदर आराम से परफॉर्म कर सकते हैं। अभी हम नेक्स्ट की तरफ चलेंगे जिसको हम बोलते हैं आपका ये वाला जो मैनिक्विन है, दिस इज नोन एज द पेशेंट, दिस इज नोन एज द नर्स ट्रेनिंग बेबी। इसमें हम लोग बेसिक प्रोसीजर्स परफॉर्म कर सकते हैं, जैसे कि आपको इंजेक्शन लगाना है, आपको एनजी ट्यूब या राइस ट्यूब इंसर्ट करनी है, और आपको इसके अंदर कैथेटर इंसर्ट करना है, वो हम कर सकते हैं। तो इसमें आपको दिखेगा आपको आई केयर करना है या आई वॉश करना है, एनजी ट्यूब इंसर्शन करना है, राइस ट्यूब इंसर्ट करनी है। साथ ही साथ में इसमें आपको कैथेटर के मॉडल्स मिलेंगे, ये फीमेल कैथेटराइजेशन भी आप इसमें कर सकते हो। ये सारे पार्ट्स जो होते हैं रिमूवेबल होते हैं, आप इसमें मेल पार्ट को भी अटैच कर सकते हो जो आपको इसके साथ मिलेगा। साथ ही साथ में यहाँ पे आपको पैड्स मिलेंगे जिसमें आप क्या कर सकते हो, सबक्यूटेनियस इंजेक्शन जो है वो परफॉर्म कर सकते हो। इसी के साथ साथ यहाँ पे बटक्स में आपको दिखाई देगा एक पैड जिसमें हम लोग आईएम इंजेक्शन टेक्निक जो है वो इसमें हम परफॉर्म कर सकते हैं। तो ये जो सारे एस्पेक्ट्स हैं ये हम परफॉर्म कर सकते हैं आपका नर्स ट्रेनिंग बेबी के ऊपर। तो दिस इज द एडवांस वन, ये हमारे पास बेसिक प्रोसीजर्स के लिए है। एडवांस के लिए आपके पास आएगा दिस इज द पेडी ब्लू मैनिक्विन। आपको दिख रहा होगा इसमें आपको ब्लूइश डिस्कलरेशन दिख रहा होगा। जो ब्लूइश डिस्कलरेशन है ये बेसिकली साइनोसिस को डिपिक्ट करता है, जब बच्चा नीला पड़ जाता है। तो इसमें आपको एक मिलेगा दैट इज योर फीडबैक डिवाइस, जिसमें आपको फीडबैक मिल सकता है, जिसमें आपको जितना परसेंटेज इंक्रीज करना है साइनोसिस can increase it up to it depends upon you how you are running the scenario for your participant. So in this particular Paddy Blue mannequin it is an advanced one. तो इसमें आप
Rahul, just give
incubation
me
का
1
भी
minute.
procedure, yeah.
Rahul, just give me 1 minute. I would request all the delegates to put their questions in the chat box. We are getting few hand raises, but it's very difficult to, allow you to talk right now. So can you please put your message, put your concerns, your questions in the chat box? Thank you.
Okay, so now we continue. It is Paddy Blue mannequin. So with the help of this, you can intubate and you may able to see the carina portion and you can intubate the mannequin itself. Along with this, you can go with the NG tube insertion. Here is the umbilical cord. So with the help of this device, you can press it and you may able to feel the umbilical cord pulsation. And here itself, there are the certain tubes where you can go with the umbilical cord catheterization, umbilical cord ब्लड सैंपलिंग, आप इसमें से अम्बिलिकल कॉर्ड की ब्लड सैंपलिंग, अम्बिलिकल कॉर्ड कैथेटराइजेशन, एक्सचेंज ट्रांसफ्यूजन, ये आप कर सकते हो इसके अंदर। साथ ही साथ इस मैनिकिन को हम लोग बोलते हैं रिसर्सिटेशन मैनिकिन। रिसर्सिटेशन मैनिकिन इसीलिए बोला हुआ है बिकॉज इसमें आप सीपीआर भी कर सकते हो और इसमें आप माउथ टू माउथ वेंटिलेशन या एम्बू बैग से आप इसके अंदर वेंटिलेशन भी दे सकते हो। और इसमें आपको फीडबैक मिलेगा, जितना आपने जैसे आप कंप्रेशन करोगे वैसे वैसे आपको इसके अंदर फीडबैक डिवाइस मिलेगा कि आप जो बच्चा है वो सही से चेस्ट को प्रेस कर भी रहा है कि नहीं कर रहा, वो सारे जो सारा रेट है वो आपको इस पर्टिकुलर डिवाइस के अंदर मिलेगा। इसीलिए हम इसको फीडबैक डिवाइस बोल रहे हैं। सो दीज आर द स्पेसिफिक थिंग्स विच वी कैन एबल टू परफॉर्म इन दिस पर्टिकुलर पेडी ब्लू मैनिकिन एंड इट इज एन एडवांस वन एज वेल एज दिस इज नोन एज द रिसर्सिटेशन मैनिकिन। So next we'll move towards the, that is NG tube trainer. So here you can see this is the face of a child, and this is a tube, and this is a stomach. So with the help of the nasal cavity, the person or the participant can insert the NG tube, and the NG tube will directly goes inside the stomach itself, and you can go with the NG tube feeding. आपको stomach wash clean करना है, जैसे कि किसी ने कोई पॉइजन खा लेता है तो हमें पूरा स्टमक क्लीन करना पड़ता है एनजी ट्यूब से, तो वो भी आप इसके अंदर कर सकते हो। So this is basically used for the NG tube, or we can say rice tube insertion procedure. So now we'll move towards the next station, which the station is known as the 3-row or obstetrical or gynecological department. So this particular mannequin is widely used in case of the normal delivery scenario. आपको normal delivery scenario दिखाना है बच्चे को, तो इसमें आपको एक fetus मिलेगा। ये fetus होगा, साथ साथ में आपको इसमें placenta मिलेगा, umbilical cord भी है। बस बच्चे को आपने यहाँ पे फिक्स करना है। और सबसे ज्यादा इंपॉर्टेंट बात ये होती है कि बिकॉज व्हेन द फीटस इज इनसाइड द मदर वूम, सो देयर इज अ लुब्रिकेशन इन द मदर वूम व्हिच इज नोन एज द एमनियोटिक फ्लूइड। एमनियोटिक फ्लूइड की मदद से बच्चा एक्सपेल आउट हो जाता है, बट दिस इज अ मैनिकिन, so there is no amniotic fluid. So what we can do is we are going to provide you a lubrication. हम आपको एक lubrication jelly देंगे। तो what you have to do is आपको वो lubrication jelly को बच्चे को पूरा अप्लाई करना है, और आपको मैनिकिन के अंदर भी सारा lubrication jelly अप्लाई करके with the help of that lubrication you may able to expel out the fetus। और आपको बच्चे को यहाँ से पुश करते हुए नॉर्मल डिलीवरी का जो मैकेनिज्म है उसको फॉलो करते हुए you have to expel out the fetus with the help of the vaginal opening. So this mannequin is ideally used for the different delivery process. You can go with shoulder dystocia, buttocks presentation, shoulder presentation, breech presentation, cephalic presentation. तो वो हम इसमें perform कर सकते हैं। Next is about the breast self examination model. So these are the different types of the 3 breast. इसमें आपको 3 टाइप्स के ब्रेस्ट मॉडल दिखाई देंगे। ये तीनों ब्रेस्ट मॉडल एबनॉर्मल एंड नॉर्मल कैटेगरी को डिफाइन करते हैं। इसमें 3 ब्रेस्ट इसीलिए दिए हुए हैं क्योंकि एक ब्रेस्ट जो है वो हमारा नॉर्मल है, दूसरा ब्रेस्ट जो है वो हमारे पास होता है मेलिग्नेंट। जब आप इसको पैल्पेट करोगे तो यहाँ पे आपको कुछ नोड्स दिखाई देंगे। आपको पता ही है कि फॉर एग्जांपल इफ इट इज अ मेलिग्नेंट, अगर कैंसर फैलने वाला है तो उसके नोड्स पूरे ब्रेस्ट में फैल जाएंगे। तो यहाँ पे जब आप पैल्पेट करोगे तो आपको पूरे ब्रेस्ट में जो नोड्स हैं वो फैले हुए दिखाई देंगे। इसका मतलब एक ट्यूमर जो है हमारा कौन सा हुआ, मेलिग्नेंट ट्यूमर हुआ। इसमें ब्रेस्ट, इसमें हमारा निप्पल इंगॉजमेंट, ये सारी टेक्निक्स आप इसके अंदर आराम से परफॉर्म कर सकते हो। तो आपने पैल्पेट किया, यू मे एबल टू फील द इट इज अ अनडिफरेंशिएटेड स्ट्रक्चर ऑफ द कैंसर विच इज नोन एज द मेलिग्नेंट कैंसर। बिनाइन कैंसर का पता करने के लिए वी हैव अ बिनाइन, दिस इज अ ब्रेस्ट वेयर यू कैन एबल टू पैल्पेट। और आपको जब पैल्पेशन आप करोगे तो आपको जो ट्यूमर होगा एक वेल डिफाइंड शेप का दिखेगा, उसमें कोई अनडिफरेंशिएटेड स्ट्रक्चर नहीं होगा, एक डिफाइंड शेप होगा जिसमें आप इजीली पैल्पेट करोगे तो आपको एक नॉर्मलाइज स्ट्रक्चर दिखाई देगा, वो आगे फैला हुआ नहीं होगा। तो इसको हम बोलेंगे आपका बिनाइन, एंड दिस वन इज नोन एज द मेलिग्नेंट वन। दूसरा हमारे पास जो है वो है आपके पास एपिजियोटमी ट्रेनर। एपिजियोटमी ट्रेनर में आपको 3 एपिजियोटमी पार्ट्स मिलेंगे। ये वाला पार्ट जो है वो नॉर्मल एपिजियोटमी के लिए है। दूसरा आपको मिलेगा जिसमें आपको एपिजियोटमी का इंसीजन मिलेगा। अब आप यहाँ पे एपिजियोटमी सूचरिंग जो है वो परफॉर्म कर सकते हो। इसमें मीडियोलेटरल, ये सारे डिफरेंट टाइप्स की एपिजियोटमी आपको मिलेंगे जिसमें आप सूचरिंग का जो प्रोसीजर है वो आप आराम से एंड इजिली यू कैन परफॉर्म। साथ ही साथ में आप तो एक आईयूडी इंसर्शन का जो प्रोसीजर है, ये हमारे पास आता है आईयूडी ट्रेनर, जिसमें आप कॉपर टी इंसर्शन कर सकते हो। आप कम्युनिटी में जा रहे हो, आपको बाहर कम्युनिटी में काफी लोगों, गांव के लोगों को सिखाना है कि किस तरीके से आप कॉपर टी इंसर्शन कर सकते हैं। तो ये डिवाइस जो है, दिस इज बेसिकली a modified device where you can teach the community people and your students ki how we are going to insert the copper T. So this is ideally used for the copper T insertion. So now we'll move towards the next station. So this was all about the three-row department, and we'll move towards the next department. The next department is about the Roga Nidan, and we can say Shalakya Tantra department. So Shalakya Tantra and Roga Nidan. So this mannequin is ideally used for the Shalakya Tantra department, and this is widely used for the Roga Nidan department. As Manali said in the starting of this virtual conference, that you need a certain mannequins in the first phase, which is known as the Roga Nidan department. So this is the auscultation mannequin. यहाँ पे आप auscultation जो procedure है, आपको cardiac sound सुननी है, different types of cardiac sound सुननी है, normal, abnormal, aortic stenosis, regurgitation. साथ ही साथ अगर आपको बाउल साउंड सुननी है या फिर आपको रेस्पिरेटरी साउंड सुननी है, वो इस पर्टिकुलर मैनिक्विन में आपको सुनाई देंगी। इसमें आपको मिलेगा एक सिमस्कोप, ये स्टेथोस्कोप होता है जिसको आपने यूज करके वो सारी नॉर्मल एंड एबनॉर्मल साउंड्स को इसमें सुनना है। आप नॉर्मल स्टेथोस्कोप को यूज नहीं कर सकते हो, आपको यही वाला सिमस्कोप जो है वो यूज करना होगा साउंड सुनने के लिए। तो अप्रोक्सीमेटली मोर देन 100 साउंड्स आप इसके अंदर सुन सकते हो, नॉर्मल एबनॉर्मल, जिसमें 3 कैटेगरीज हमारी आती हैं, जिसमें आप रेस्पिरेटरी साउंड सुन सकते हो, कार्डियक साउंड्स आप सुन सकते हो, एज वेल एज यू कैन एबल टू हियर द बाउल साउंड। So this is ideally used for the Roga Nidan department, where you can able to hear a different normal, abnormal, respiratory, cardiac, and the bowel sound. This mannequin is ideally used for the Shalakya Tantra. This is basically an ear examination trainer. So you need a device where with the help of the device you may able to see the different pathological condition which is basically present in the ear cavity of the patient. So right now I'm not able to show you the different pathological conditions because you need a medical device, and with the help of the device you may able to see the condition. So like this, with the help of this device you may able to see the different conditions, pathological condition. So there are more than 100, more than 70 and 75 conditions are there. So for example, you want to see otitis media, आपको earwax देखना है, or if you want to see the otitis media of third stage. So these are the different conditions you may able to see in this particular ear examination training. So these are the conditions. More than 75 conditions are there, and you can able to see the different conditions with the help of this ear examination trainer. So these two mannequins are basically based on Shalakya Tantra as well as Yoga Nidan. And there is one more particular device which is known as which is widely used in case of that is trauma scenarios. For example, अगर आपको कुछ ऐसा केस रन करना है कि पेशेंट का खून निकल रहा है कुछ ऐसा, तो you can use these devices, जिसमें आप you can use the artificial molasses, जिसको आप कहीं पे भी अप्लाई कर सकते हो। इसमें फ्रैक्चर का आपको केस मिल जाएगा, इसमें आपको ब्लीडिंग का केस मिल जाएगा, किस तरीके से उसको ब्लीडिंग को स्टॉप करना है। तो this particular mannequin is ideally used for the trauma scenarios. So now we'll move towards the next stations. So here you can see this particular task trainer. This is known as that is suturing, or we can say the bandaging trainer, the wound care and bandaging trainer. इस particular mannequin में आपको दिख रहा होगा there are the different suturing procedures they have performed. So what we can do is we can able to perform a bandaging procedure in this mannequin, as well as you can go with the wound care procedures. तो इसमें आप wound care भी perform कर सकते हो, along with that you can able to perform the different bandaging procedure. किस तरीके से bandage application करना होता है, all these procedures you can able to perform in this wound care and bandaging trainer. Even the additional feature of this particular mannequin is you can able to perform a suture care, because there are different types of suture. There are stoma is present, so you can go with the stoma care. So these are the different procedures you may able to perform in the bandaging and wound care. So now we'll move towards the next one. The next mannequin is about these three-row department, the obstetrical and gynecological department. This is not a birthing mannequin. ये birthing mannequin नहीं है. This is basically a gynecological skill trainer, जहाँ पे आप basic procedure जो होते हैं gynecology के वो perform कर सकते हो. For example, आपको PV examination करना है, तो you can go with PV examination. आप abdominal palpation करना है आपको, you can go with the catheterization. तो दिस आपको HPV टेस्टिंग करना है, आपको आपको क्या, आपको एक फॉर एग्जांपल आपको पैप स्मीयर सैंपल लेना है. सो दिस ऑल प्रोसीजर वी कैन एबल टू परफॉर्म. और इसी के साथ साथ आपको डिफरेंट यूटेराई एंड यूटरस मिलेंगे जो आप इसके अंदर अटैच कर सकते हो, बिकॉज दिस इज एन दिस होल पार्ट इज एन दिस होल पार्ट वी कैन एबल टू ओपन इट. इस पूरे पार्ट को आप ओपन कर सकते हो. एंड हियर यू कैन सी यू कैन अटैच दीज पार्ट्स. These parts we can able to attach over this area. You can remove these parts, we can remove these one, and we can able to attach the new parts. So these are the attachable parts, and you can attach the new parts over this specific area where you can able to feel the different structures, whether it is a benign or malignant, because here you can see there are different normal and abnormal uterine uterus. This one is the abnormal one because you may able to find there are different undifferentiated structure. And this next one is this one. This is the benign one because there is no any abnormal mass is there. So what we can do is we can remove this one and we can apply the normal one. So you can, so what we can do is we can apply the new one and you can attach it over the specific area. So with the help of this one, you can teach your students the different fibroidal condition, different uteri, different uterus, and there are normal and abnormal conditions. So next we'll move towards the Panchkarma department. So in the commission itself, in the mandate itself, it is mentioned you need one mannequin which is basically required for the Panchkarma department, which is known as the full body mannequin. So this one is the full body mannequin. As per your profession, as per your department in Panchkarma department, we widely using this mannequin for a different procedures. But for your profession, you can use this mannequin for the Panchkarma department because as you know, you used to apply the tail, you used to use certain medications which you used to apply over the patient body. So those procedures you can able to perform in this particular full body mannequin, and this is a flexible mannequin. You may able to move the hands of the particular mannequin. You may able to rotate the hand, the different structure. You can rotate the neck part of the mannequin itself. Even you can able to remove the leg portion, leg part. You can rotate it. Each and every procedure we can able to see in this particular full body mannequin itself. But as per your mandate, as per your department wise in Panchkarma, we are using this mannequin for the application of tail, some medications, or for example, if you want to go with the ear irrigation, you want to clean the eye, ear irrigation, eye irrigation. इसमें what we can also do is you can insert the NG tube. यहाँ पे आप NG tube insertion भी कर सकते हो. NG ट्यूब इंसर्शन के साथ साथ व्हाट वी कैन डू इज आप गैस्ट्रिक लवाज गवाज, जैसे ही हमने NG ट्यूब में इंसर्शन किया, NG ट्यूब इंसर्शन करने के बाद यू मे एबल टू सी द हॉलो स्टमक. आपको यहाँ पे एक हॉलो स्टमक दिखाई देगा. ये स्टमक रिमूवेबल स्टमक है. यू कैन रिमूव दिस स्टमक. यहाँ से स्टमक को हम रिमूव कर सकते हैं एंड यू कैन fill the gastric content in the stomach itself. आपने NG tube insert किया, the NG tube will goes inside this esophagus and directly it will goes inside the stomach and you may able to give the NG tube feeding. आप NG tube feeding करवा सकते हो और अगर आपको कुछ मेडिसिन देनी है जो आपको NG tube से देनी है वो आप दे सकते हो. आपको गैस्ट्रिक कंटेंट जो है वो खाली करना है तो आप वो NG tube से उस गैस्ट्रिक कंटेंट को खाली कर सकते हो. तो दीज आर द स्पेसिफिक प्रोसीजर. और इसके साथ साथ जैसे कि मैंने पहले भी कहा था कि आपको बस्ती का रिक्वायरमेंट होता है. बस्ती के जो प्रोसीजर्स हैं, फॉर एग्जांपल कैथेटराइजेशन का है, तो वी कैन एबल टू इंसर्ट द कैथेटराइजेशन. इसमें आपको मेल फीमेल पार्ट दिखेगा जिसके अंदर हम लोग मेल फीमेल कैथेटर इंसर्शन भी कर सकते हैं. साथ ही साथ में इसमें एनल ओपनिंग भी होती है. एनल ओपनिंग के लिए फॉर एग्जांपल आपको जैसे कि फ्लेटस ट्यूब इंसर्शन करना होता है फॉर द बस्ती इंसर्शन, इसमें आप तेल या मेडिकेशन इंसर्ट करते हो. तो फॉर द बस्ती इंसर्शन वी कैन एबल टू परफॉर्म, वी कैन एबल टू यूज दिस मैनिकिन फॉर एज अ कंप्लीट होल पैकेज. फॉर एग्जाम्पल आपको अलग से कोई कैथेटर मॉडल नहीं लेना है, सो यू कैन यूज दिस पर्टिकुलर फुल बॉडी मैनिकिन फॉर द every and each procedure. Like your Basti examiner, Basti trainer, you can use for the catheterization, or for NG tube insertion, you can insert the NG tube also. You can go with the gastric lavage, gavage. These procedures you may able to perform with the help of this full body mannequin. As per the Panchkarma department, you can use this mannequin for the application of tail, some medication, some paste, and some powders. So this was all about the basic mannequin. So what we are going to do is we are going to move towards the next station, which is known as the ACLS mannequins. So now what I'll do is I'll hand over the mic to Miss Manali first, and then we'll move towards the next station, which is known as the ACLS department, where you can able to perform the advanced cardiac life support scenarios.
So we will take you to the emergency department of this particular lab, a simulated emergency department, which has a ALS mannequin, advanced life support mannequin. So in this particular mannequin, it's a high fidelity mannequin, and you can run various advanced life support, advanced cardiac life support scenarios in it. We will just take you through it. Just give us a couple of minutes to adjust the cameras. I would again request you all to post your comments or your questions in the chat box. There is a small message like symbol at the right bottom, which you can see, and you can post your questions over there, if any. Let's have a look at ACLS mannequin.
So now next we'll discuss about the ACLS mannequin. As per your mandate also, you need a BLS simulators as well as the ACLS mannequin. So this mannequin is basically a full package of the ACLS. This one is known as the Atlas mannequin. So first I will tell you what all features you may able to find in this particular Atlas mannequin or ACLS. ACLS is Advanced Cardiac Life Support Mannequin. You can intubate this mannequin. You can go with the NPA insertion. You can feel the carotid pulse. आप इस मैनिकिन carotid pulse को भी feel कर सकते हो. आप इस मैनिकिन में इंजेक्शंस भी आप अप्लाई कर सकते हो विद द हेल्प ऑफ दिस वन. आप इसमें इंट्रा ओशियस इंजेक्शन भी दे सकते हैं, एंड अलोंग विद दिस वी कैन गो विद द सीपीआर प्रोसीजर आल्सो विद द हेल्प ऑफ दिस मैनिकिन. तो आप इसमें सीपीआर भी परफॉर्म कर सकते हैं. नेक्स्ट थिंग इज along with this mannequin you may able to get this device also. तो ये mannequin के साथ आपको you have to buy this particular setup also, because with the help of this particular setup or the eye simulate you may able to change the scenarios. जैसे कि आपको कार्डियक अरेस्ट देना है, हमें बच्चों को सिखाना है कार्डियक अरेस्ट होता क्या है, उसकी डिफरेंट रिदम्स कैसी होती हैं, कौन कौन सी रिदम्स कार्डियक अरेस्ट की होती है, तो इसमें हम लोग शो कर सकते हैं. दिस इज फॉर द स्टूडेंट सेक्शन and this one is for the instructor iPad. So with the help of this particular iPad, you are the person who is operating this particular device. इसको आप ऑपरेट कर रहे हो और इसको जो है बच्चा देख रहा है, और बच्चा इस पर्टिकुलर सेटअप को देख करके अपना स्किल का जो सिनेरियो है वो रन करेगा. फॉर एग्जांपल अगर उसको लगता है कि मुझे पेशेंट जो है वो कार्डियक अरेस्ट में जा रहा है, तो मेरे को सीपीआर करना है कि नहीं करना, बच्चे को पल्स चेक करनी है, तो पल्स वो आपके ऊपर डिपेंड है कि आप पल्स दे रहे हो कि नहीं दे रहे हो उस सिनेरियो में. बच्चे को बीपी चेक करना है, तो बीपी कब उसको भागना पड़ेगा, तब जाकर के आपको इसमें रीडिंग शो होगी. फॉर एग्जांपल हार्ट रेट है, यहाँ पे बहुत सारे एबनॉर्मल हार्ट रेट्स आपको दिखाई देंगे, जिसमें साइनस है, कार्डियक अरेस्ट है, एट्रियल एबनॉर्मेलिटीज हो जाती हैं, वेंट्रिकुलर एबनॉर्मेलिटी है. सपोज मैंने अभी क्लिक करना है
Rahul, can you
कार्डियक
come a
अरेस्ट.
little closer to the camera? Yeah, thank
This
you.
is visible. So what I'll do is there are different abnormal rhythms. So what I'll do is, for example, sinus. So this one is a sinus one. So there are different sinus rhythms. Sinus, sinus 2, and then sinus P wave. The second one is cardiac arrest. So this one is the cardiac arrest rhythm. There are different cardiac arrests where you may able to find agonal, P wave asystole, then VT and VF. So for example, now I will change the rhythm. So now you will able to see ventricular fibrillation. Now in the monitor itself, you may able to see there is a VT condition. So now I'm going to change this one. So this ventricular fibrillation, I will send it. Now there will be a change.
Let's
in
take
the
the
rhythm
camera a
in the,
little ahead and show the patient monitor as well.
can take a camera. It is visible. Okay. So now I'll change I'll go to cardiac arrest. Now what I'll do is I'll change the rhythm. So now I'm going to show you the P wave asystole. So I'll click on the P wave asystole, send it. Now here you can see there is a fluctuations in the rhythm. So from VT, it is directly goes inside the P wave A system. So you can change the rhythms as per your scenario, but always remember you have to prepare your script while you are teaching your students or while you are running the scenarios in case of the simulation lab. There is a BP1, so there will be an ETCO2 or respiration. You can fluctuate the respirations also. There are different checklists also available. You can feed your own checklist. You can feed your own different checklists also, as well as there are different medias. There are different sounds. For example, questions.
I'm having a heart attack. Where's my husband?
There are different conversation.
Hello? Yes. No. Left. About a week.
There are certain responses.
I can't breathe. I want to go home. My arm hurts.
So this is a US async, but what you can do is you can feed your own sound itself. आप अपने लैंग्वेज में वो साउंड को फिट करके आप बच्चों के साथ वो सिनेरियोस को परफॉर्म कर सकते हो. Now there are different bodily sounds. Vomiting. There are different medias. There are different CT scan, X-rays are also available. So as per your convenience level, you can put the X-ray and you can show to your participant. Or what you can do is you can feed your own patient X-ray also. So here you can see, you can able to see the particular structure of the CT scan in the monitor itself. Or what we can do is we can project this particular setup in the larger screen also. So there are different scenarios which we can able to perform with the help of this particular setup as well as with the help of this setup and along with this particular mannequin. So there are multiple things you can able to perform. So there are different things which we can able to perform with the help of this device. So this whole setup is ideally used for the ACLS scenarios. You can run your own scenarios, or for example, if you want to open your own AHA training center, that is known as your American Heart Association Center, you can open with the help of these suitable mannequins, because these mannequins are recommended by the American Heart Association also, because they may follow the guidelines of AHA also. So this was all about the, that is ACLS mannequin.
Let's have a look at the airway intubation mannequin. Just for you to get an idea of our wide range of products. This is as such not required in Ayurvedic mandate, but you can just have a look at the airway intubation mannequin in case there is any interest. Thank you.
So now comes towards the another advanced mannequin, or which is known as the intubation head, or this is a surgical airway trainer, or it is also known as the Delta 1000 mannequin. This particular mannequin is ideally used for the procedure. For example, if you want to go with the advanced airway insertion or basic airway insertion. Advanced airway means आपको intubate करना है patient को, आपको tracheostomy insert करनी है, या फिर आपको LMA insert करना है, या फिर आपको इसके अंदर basic airway insertion करना है, जो हर कोई insert कर सकता है, जैसे कि आपको OPA insertion करना है, oropharyngeal airway, nasopharyngeal airway, या फिर अगर आपको bronchoscopy भी करनी है तो इसमें आपके well defined bronchus है, इसके थ्रू आप bronchoscopy भी कर सकते हो. आपको लरिंजोस्कोपी करना है, मतलब आपको वीडियो लरिंजोस्कोपी करना है, तो आप लरिंजोस्कोप को इंसर्ट करके विद द हेल्प ऑफ दैट वीडियो यू कैन एबल टू इंसर्ट द एंडोट्रेकियल ट्यूब. आप इसके थ्रू बैग मास्क वेंटिलेशन भी कर सकते हो. विद द हेल्प ऑफ दिस बैग मास्क डिवाइस आप इसके अंदर you can able to push out the air, and you may able to see there is an inflation of the lungs. And for the intubation, you can able to insert the laryngoscope and you can easily see the particular vocal cord, and with the help of the vocal cord there is a carina portion. You can lift up the epiglottis and you can insert the endotracheal tube inside the vocal cord. And after the insertion of the endotracheal tube inside the vocal cord, so what you can do is you are going to check whether it is in a correct area or not. So what we are going to do is we can go with the that mass. So here you can see there will be a inflation of the both the lungs. So these are the inflation of the lungs. So this is known as the correct insertion of the endotracheal tube. So it will give you a feedback also whether you have inserted into the trachea or whether you have inserted into the esophagus itself. So it will give you a feedback. There is a chest crisis there. अगर आपको इंट्यूबेशन और डिफिकल्ट बनाना है तो हम क्या कर सकते हैं, इसमें एक प्रोब है, एक प्रोब लगा हुआ है, इस प्रोब में आप सिरिंज की हेल्प से एयर को पुश कर सकते हो और एयर पुश करने की वजह से क्या होगा, जो टंग होती है वहां पे एडिमा हो जाएगा, वो स्वेल्ड हो जाएगी और स्वेल्ड होने की वजह से क्या होता है, जो पाथवे होता है वो हमारा नैरो हो जाता है और नैरो होने की वजह से आप ईटी ट्यूब को अच्छे से इंसर्ट नहीं कर सकते। इसका मतलब वो इंट्यूबेशन जो हो जाएगा आपके लिए वो डिफिकल्ट हो जाएगा। साथ ही साथ यहाँ पे आपको एक फ्लैप मिलेगा, इसको हम बोलते हैं नेक फ्लैप। ये नेक फ्लैप में आप इंसीजन करके यहाँ पे हम ट्रेक्योस्टमी को इंसर्ट कर सकते हैं, ट्रेक्योस्टमी इंसर्शन हम कर सकते हैं। तो इसमें आपको डिफरेंट टाइप ऑफ लैरिंग्स मिलेंगे जो अटैचेबल होते हैं, डिटैचेबल भी होते हैं, आप इसको अटैच भी कर सकते हो आराम से। आपने ये रिमूव करना है, आप इसको रिमूव भी कर सकते हो और आप इसको अटैच भी कर सकते हो। तो हमारे पास जो क्रिकॉइड कार्टिलेज है, क्योंकि ये हमारे पास है थायराइड कार्टिलेज, क्रिकोथायरॉइड एंड क्रिकॉइड कार्टिलेज, so here you can able to go with the needle percutaneous tracheostomy insertion also. So this mannequin is a complete package where you can go with the advanced airway insertion as well as the basic airway insertion. So this was all about the different mannequins which was required by your profession, your department. So I hope you may get a brief idea regarding these particular mannequins. If you may have any questions, so what we can do is at the end of this particular meeting, we are going to take some question and answer session. So we'll discuss those questions at the end of this virtual meeting. So thank you so much.
Rahul, Dr. Dhanya Raj wants to see the neonatal resuscitation mannequin once again. Sure, ma'am. It's working in detail, Rahul. After this demonstration, we will be taking you through the virtual tour of the entire skill lab. We know we have been, little quick in the demonstrations, and in-depth demonstrations could not be done due to time limitation.
Okay. So now, as madam is having some query regarding the resuscitation of the pediatric mannequin. So ma'am, we do have a different kind of the resuscitation mannequin in terms of the pediatric department. We have a neonatal resuscitation mannequin. Along with that, we have one which is known as the premature baby, where you can able to go with the resuscitation procedure also. So the basic feature of these two mannequins may resemble same, because this is also known as the intubation one, because we can intubate this mannequin also. Along with this, we can able to go with the NG tube insertion, you can go with the resuscitation, you can do the chest compression. Along with this, you may find a certain and neural tube defect procedure. So what we can do is, there are certain neural tube defects are also available, so which we have to put it over the specific area. There are certain neural tubes, so we have to place it over here.
Can we
so
have the camera a little closer?
Yes.
Pinal?
Yes, yes, sure.
Yeah, it's better.
Okay. So this is known as the resuscitation mannequin, or the pediatric one, which is ideally used for the different procedures. So I'll start with the basic one. So here you can see there is a nasal opening. So in one opening there you can insert the NG tube. So with the help of this, you can go with the NG tube insertion, you can go with the eye care, as well as you can go with the eye irrigation. With the help of this particular oral opening, you can intubate the mannequin with the help of your laryngoscope, and you can able to see the carina portion, or we can say the vocal cord. And with the help of this opening, you may insert the endotracheal tube and you can intubate the patient. And after the intubation of this particular mannequin, there will be a chest rise. You may able to see the chest rise while you are going to attach the ambu back. Along with this, you can insert the basic airway. For example, if you want to insert the OPA insertion, so we can able to insert the OPA also. So this OPA insertion as well as the NPA insertion, along with this, you can go with it is ET intubation procedure. And second thing is there is one pump. So with the help of this pump, you have to press this pump and you can able to feel the umbilical pulse also. So you can feel the umbilical pulsation. Along with this, you can able to see there are certain openings. So with the help of these openings, what we can do is you can go with the umbilical cord. You can do the umbilical cord care. You can go with the umbilical cord blood sampling, as well as you can go with the umbilical cord catheterization. You can insert the catheter, you can aspirate the blood sample with the help of the umbilical cord, because there are certain tubings present. So with the help of these tubings, you can insert the blood, you can insert you can also remove the blood, because जैसे ही मैनिकिन का सारा प्रोसेस खत्म हो जाता है तो हमें उसके बाद सारा ब्लड जो है वो बाहर निकालना पड़ेगा. सो अम्बिलिकल कॉर्ड कैथेटराइजेशन, अम्बिलिकल कॉर्ड सैम्पलिंग, ये आप इसके अंदर परफॉर्म कर सकते हो. Along with this, you can go with the 2 rescuer CPR and single rescuer. आपको कंप्रेशन करना है. I'll show the compression one. Is this visible? If I'm going to do the compression, so here you can see there will be a, whenever I'm going to compress it, you can able to see the feedback also. And along with this, you can go with the two thumb compression, or we can say encircling technique. And these are 2 finger technique. And this one is the encircling technique. Along with this, what we can do is you can able to show the cyanosis condition. आपको बच्चे को नीला दिखाना है पूरा, तो इसमें एक साइनोसिस कंडीशन विजिबल होती है. दिस इज अ साइनोसिस 1. अभी मैंने इसको 100% पे रखा हुआ है. एज पर योर सिनेरियो आप इसको 50%, 20% कैसा भी कर सकते हो. तो जैसे मैंने 100% पे किया है, तो आई क्लिक ऑन ओके. नाउ यू कैन सी देयर इज द डिस्कलरेशन इन द चेक्स, discoloration in the peripheries, in the lower limb also. So this particular setup is known as a cyanotic condition. And for example, what you can do is you can run the simulation scenario along with your participant, and you can give them this scenario ki, okay, the child has born, the newborn is born, and now he is suffering from this particular cyanotic condition. So what was your prompt action? आप उस टाइम पे क्या करोगे? आप उनको केस दे सकते हो. इस तरीके से आप उनको केस दोगे, बच्चा उस टाइम पे अपना क्रिटिकल थिंकिंग को इनहांस करके उस केस का जो मैनेजमेंट है वो एक्सप्लेन करेगा आपको. दैट्स व्हाई दिस इज एन एसेंशियल रिक्वायरमेंट ऑफ द मैनेकिन्स इन द आयुर्वेदा डिपार्टमेंट. So I hope I cleared your doubts regarding this resuscitation mannequin. Okay.
Rahul, per speculum and per vaginal examination trainer. Yeah, Dr. Jasmine Gujarati.
So, Madam Jasmine is having a doubt regarding the gynecological skill trainer. So, this is known as the gynecological skill trainer. It isn't completely a removable part. We can remove this whole part, and there are certain attachable parts are there. So, here you can see this is a balloon. So, with the help of this port, what we can do is we can inflate it. So, this will become the bladder. So, what we can do is we can catheterize this gynecological skill trainer, and with the help of this, you can release the balloon. And the next thing is what we can do is there are different uteri. बहुत सारे आपको different में structures मिलेंगे. आपको fibroids मिलेगा, and these are the detachable one. आप इनको detach कर सकते हो. Detachable one है, और इसको आपको बस यहाँ पे fix करना है. When you are going to fix it, आपने जैसे ही fix किया, आपको बस इनको attach कर देना है इनके साथ. जैसे ही आपने अटैच किया, ये अटैच होने के बाद नाउ व्हाट वी आर गोइंग टू डू इज वी आर गोइंग टू कवर इट. कवर करने के बाद अब इसमें आपको बहुत सारे पार्ट्स मिलेंगे. जैसे कि जो मैंने अभी अंदर अटैच किया है, इट इज द सेम पार्ट, बट there are certain abnormal and normal condition. तो इसमें बहुत सारे आपको normal abnormal conditions मिलेंगी जो आप attach कर सकते हो as per your scenario for your participant. If you want to show the normal one, so you can show the normal one. If you want to show the malignant one, so you can show the malignant one and you can attach it over here. And you can attach from this aspect. And now with the help of the speculum, because right now we don't have any kind of speculum. So whenever, if we may get chance to come to your college, for example, in case of some demonstration parts, so you can arrange those speculum and we can able to show you the different conditions where you can able to see the different parts, different areas of the normal uteri and uterus. So with the help of this one, so I'm going to show you, as you can see, this portion, there is one opening is there. So with the help of this opening, you can insert the catheter. And with the help of the speculum, you are going to widen the area. And after the widening of area, you can go with the PV examination and you can able to visualize the internal structure of the cervix also. So this is ideally used for only for the skill trainer, where you can able to take the pap smear test with the help of the with the help of a swab stick. You can insert and you can take a scrap and you can remove the scrap with the help of the stick itself, and you can able to take the pap smear test also. So this is basically about the gynecological skill trainer. So I hope I may cover the different doubts which Miss Jasmine Mr. Miss Jasmine may have. So if there is anything else you want me to explain, so I'm open to explain the thing.
Thank you, Dr. Jasmine and Dr. Dhanya. Any more questions regarding the products? Okay.
Hello.
So,
Hello.
yes, ma'am.
I'm Dr. Prajakta Tomar, principal of Murlidhar Ayurvedic College, Rajkot. Actually, I wanted to know what is the estimated cost in case you want to have for the departments. You
Yeah,
told
ma'am.
that you can use the same mannequin for different places
Yeah.
also, different
So,
departments
ma'am,
also.
the whole body mannequin that was shown to you, that has more number of skills that can be covered, and it can cover more than one departments. So regarding the phase wise implementation, we'll get to that topic after the virtual tour. Just allow us few minutes. And regarding costing, ma'am, we cannot give you the exact costing of the entire setup as such. We need to know some prerequisites from your end before we give you the pricing, but we'll give you a fair idea, a rough idea of it. So just stay tuned. We'll show you the lab first, and then we'll get back to the phase wise implementation. Okay. Thank you, ma'am.
Okay.
Give us just 2 minutes for the virtual tour. So the setup over here, Bailal Amin Hospital Skill Lab is spread across around 2.5, 2,500 to 3,000 square feet. And uh, we also want to show you the Pragya Skill Lab setup, which is spread across 10,000 square feet. Okay, so till the time our team adjusts the camera for the virtual tour of Bailal Amin Lab, I will just take you through Pragya Skills Lab, which is Parul University's skill lab, one of its kind. Just give me a minute. हाँ, क्या हो गया? है ना ये ऑन? ये ऑन है ना? शेयर टैब ऑडियो तभी भी नहीं आ रहा ना? ठीक है, इट्स ओके. There is some difficulty in getting the audio, so let's watch it again. So we just now saw the Parul University Skills Lab, Pragya Skills Lab, which was spread across 10,000 square feet of area. Now let's have a virtual tour of Bhaila Lamin Skills Lab, which from where we are presenting right now.
So once again, a very warm good afternoon to one and all present in this virtual meeting. So now I'm going to show you the virtual tour of Bhailal Amin General Hospital Skills Lab. So this lab is basically set up by Delta Healthcare in the Bhailal Amin General Hospital. So this lab is spread across 2,000 to 2,500 square feet area. So now let's join us in the virtual tour of this particular skill lab. So here you can see this is this particular station. This full station is known as the skill stations, where you may able to find a different tables where you can perform a different examination or the different procedure. So as during the product demonstration, I came across the different department, different areas where I have shown you the different products which is responsible for the different procedures. So here you can see this is basically for the routes of medication administration station. Then we'll jump towards the next one, where the students can able to perform a Shalya Tantra procedures, for example, like catheterization, suturing procedure. And this is basically for the Shalya Tantra department. And this setup is basically used to give the real essence or real essence to the participant regarding the particular skill lab. So now these are the particular stations where you can kept your mannequins and you can able to perform the different procedures. So these are the defined tables which we have given them idea ki how you have to prepare the skill lab. We have given them layout, we have given them that basic infrastructure of how you are going to develop this particular skill lab, and we have supplied the mannequins where you can able to where you have to place the mannequin and how you are going to perform the procedure. So hand holding is also given by us also. Now here you can see this is the hand washing area. So after this whole portion is basically used for the hand washing. But if I talk about the Ayurveda department, so in your profession, as per your mandate, it is required that there should be one practice station room as well as there should be a specific demo room. So what you can do is, suppose if you are planning to develop a skill lab, so what we can do is, being in this particular profession or being in this particular setup from last 13 or 14 years, so what we are doing is we are giving you an end-to-end solution regarding the development of a skill lab, like how you are going to set up the skill lab, how you are going to make a stations for each and every procedures, and how you are going to perform those procedures. Because being in a medical background, we are going to train you regarding in terms of a specific procedure, as well as we are going to train you in terms of the simulation methodology. So here you can see there are the different hand washing areas. Now in the next area, there will be a certain beds which we used to kept for the mannequin, which is required in terms of a specific procedure. So here you can see this is a mannequin which is basically for the bandaging and wound trainer. There is another bed which is where we have kept one gynecological skill trainer, and the next bed where we have kept the full body mannequin. As per your department wise, you can use this one for the panchkarmas. Then there will be one station for the instructor where the instructor can sit and he and she can perform their specific task while sitting in this particular area. As this lab is basically in the Bhailal Amin General Hospital, so this is known as a nursing station, which we used to call it as. But as per your profession, as per your department, so what you can do is you can prepare the station same like this, and what we can do is you can keep this station for your instructor, because you need one instructor for your skill lab while you are going to develop this skill lab. Because the running of a skill lab is important, because everyone can make a skill lab because they may have budgets or they may have an area for developing skill lab, but nobody knows how to run those skill lab and how they can generate the revenues from those skill labs. So next we'll move toward the next area. So here you can see this station is basically, we are calling it as a debriefing station, but as per your mandate, what you can do is you can make these stations for particularly for the demo classes. And what you can do is you can use these stations for the classroom setup also, where you can train your participant in terms of the theoretical knowledge also, where you can teach them regarding the basic aspect of the procedure, and then you can jump towards the demo room, and then you can shift your participant towards the demo room also. So next we'll move towards the next station. You can keep the projector. There should be a one screen where the students can able to see the things over this particular projector area. Or what you can do is you may have one this one, the TV, where you can able to project the things into the specific thing. Now we'll move towards the other area, which is known as the emergency area, or you can prepare that particular room as your emergency department area. And what you can do is you can keep all the necessary articles or necessary equipment which is required in the emergency department. So this whole setup is basically, or this whole room is basically for the emergency department area, where you can keep a full body mannequin, and you can keep a different necessary emergency equipment. For example, crash cart trolley, different medications, different intubation procedure equipment. Those particular setup, you can keep it over here, and you can run the different scenarios with the help of this particular room setup. So as per your mandate, if I talk about the Ayurveda department, you may have one full hall type structure where you can keep one demo room, one practice room, and one room where you can place your students to teach them regarding the different aspects of the different procedures. So this was all about the virtual tour of the Bhailal Amin Research Hospital. So thank you so much.
After this, we will be talking about uh, the phase-wise implementation. Yeah. So I hope today's session was informative regarding with respect to the products and the virtual tour of the lab. Let's move ahead with the next session, which is a phase-wise implementation. As we've seen, the mandate mentions about 3 phases, okay, and the entire uh, lab has to be completed in a certain period of time. Uh, First phase, they have mentioned about ALS, BLS, which goes for all the departments, and then the first professional subject, which consists
ECG trainer,
ECG
technical test
trainer,
trainer.
and auscultation. Auscultation. So basically, the auscultation trainer can be clubbed with the whole body mannequin. The whole body mannequin comes with auscultation feature as well. So that's what I was saying. Principal ma'am had the question about the costing. So the product range from right from 35 to 40,000. Few products are start from 40,000 and it goes to few lakhs as well. So when the products are high fidelity, the cost is little on a higher side. If you start with suture arm, it costs around 40,000, somewhere around 40,000. So there are the entire range of products is we have a wide range of basically pricing available with us. So we would not prefer to give away the pricing right now because it depends on what exactly would be your requirement. So at the end of this session, we would circulate an inquiry form in which you give us exact requirement of yours, what space you have, what kind of setup are you looking for, are you going to go for all the products initially, or phase wise what they have given that you're going to plan, or as per budget. So if you have any specific budget, you let us know and we plan it accordingly. So that's what it is.
Yes. So now,
Ma'am, one question I had.
the importance of a skill lab in the Ayurveda department, because being in a medical profession, I know the importance of a skill lab. Because whenever we used to perform the procedure being a student, so not everybody get a chance to perform the procedure. So it is important that each and every student who has spent the money in the Ayurveda college, medical colleges, nursing, they have a right to perform each and every procedure. So many of the students may not able to get a chance to perform those procedures, whether it is intubation or whether it is an IV injection, IV administration. So what we can do is we can enhance their competency skills with the help of these particular mannequins. I'll give you an example. जैसे जब हम बच्चे थे तो हमने एक कहानी सुनी थी कि जिसमें एक कौवा होता है, जब वो उसको प्यास लगती है तो वो घड़े में जाकर के कंकड़ डाल के पानी उसका ऊपर आता है घड़े का, फिर वो पानी को पीता है. लेकिन अब वो कौवा इतना अपडेट हो चुका है कि वो कंकड़ की बजाय वो स्ट्रॉ से पानी पी रहा है. तो हम लोग भी क्यों ना अपने आप को इतना अपडेट करें कि हम लोग भी उस जो एडवांस स्किल्स, जो एडवांस प्रोसीजर्स के लिए जो मैनेकेंस की रिक्वायरमेंट है, वो हम सब लोग यूज करें और हम लोग वो अपने प्रोफेशन के अंदर लेके आए. बिकॉज एज इट इज रिक्वायर्ड इन द मैंडेट इटसेल्फ, बट स्टिल वी नीड टू एनहांस द कॉम्पिटेंसी लेवल ऑफ द पार्टिसिपेंट. हमें हर एक मेडिकल प्रोफेशन हो, नर्सिंग हो, आयुर्वेदा हो, सिद्धा है, यूनानी है, होम्योपैथी है, हमारे पास न्यूमरस बच्चे पास होते हैं हर ईयर, बट उनकी जो क्लिनिकल स्किल्स है, क्लिनिकल कॉम्पिटेंसी है, वहां पे हम कहीं ना कहीं लैक कर जाते हैं. तो उन पर्टिकुलर स्किल्स को इनहांस करने के लिए व्हाट वी कैन डू इज वी कैन इनहांस देयर स्किल्स विद द हेल्प ऑफ दोस पर्टिकुलर मैनेकेंस. बिकॉज एट द एंड हम लोग किसी की लाइफ के साथ खेल रहे हैं, तो किसी की लाइफ को अगर रिवाइव करना है, सो वी हैव टू अपग्रेड आवरसेल्फ इन टर्म्स ऑफ द मेडिकल सिमुलेशन और इन टर्म्स ऑफ द different aspects of the different procedure. So we are there for you if you need any kind of help in terms of acquiring, purchasing mannequins, in terms of developing a skill lab. We are giving you an end-to-end solution from starting giving your layouts, giving the layouts, then purchasing of mannequins, then hand holding. 6 months तक हम लोग आपको hand holding करवाते हैं. Even we are going to perform the procedure as per your guidelines, the different procedure as per the guidelines given by the different agencies. So we used to handhold you as well as your students. We can conduct different workshops for your students, for your faculty members. Even we can conduct a different simulation methodology trainings for you and for your students also.
Here is the inquiry form which you can scan on your phone and put up your inquiries. Any specific products pricing you need. So principal ma'am, you had the query of what would be a rough estimate of your lab. So basically, ma'am, it will completely depend on what exactly are you planning for this initial phase. If you want me to give a rough idea of this lab, whatever products you've seen so far, we can tell you this was the products went around approximately 75 lakhs. Okay, just for you to get a rough estimate of it. So you can just,
Ma'am, I had one question.
I mean, you can just check the inquiry form and put your inquiries in it. Secondly,
Ma'am,
Bhaila Amin lab.
Manali, someone has a question.
Sorry.
hello, ma'am. Manali, ma'am. Hello. Hello.
Yes, please
Manali,
tell
ma'am.
me.
Just
Yes,
give
sir.
me a minute.
Ma'am, I had just one question. Whether are you having a brochure on anything where we can? Hello, can you hear me?
Yes, ma'am. We are able to hear you.
Huh. I just wanted to know whether you are having any brochure for various whatever you are having skill
Yeah.
lab equipments. Are you
Yes, ma'am.
having any brochure?
Yes.
Because see,
So what?
all the colleges may not be able to purchase everything together at one time,
Yes, understood, ma'am.
right? Huh. So they may plan according to their whatever is required most. Or or do you have any year wise also key first for first year you need all
Yes.
these things, they are
Yes, ma'am.
important,
Yes, ma'am.
you should
Because
have.
in your mandate itself, it is
Likewise,
recommended
if
that.
you are having something, some that kind of planning, you can share with us.
Yeah. So what we can do is, ma'am, that you are in the WhatsApp group. Yes. You are
I'm
having
in the
the
WhatsApp group.
So what we can do is we are going to share you our company catalog in the WhatsApp group itself, so you can able to see from that WhatsApp group.
So, ma'am, you can meanwhile check our website deltahealthcare.in, on which you will find quite good amount of details, and we will
Hmm.
keep on sending informative stuff on the WhatsApp group. So, request you all to not leave the group, okay?
You
And
are covering the AMC also. Suppose in case if some maintenance is required for some, hello, some equipments, are you covering that also?
I'll answer that, Manali.
yeah,
So, firstly, if you can get your institute name, your email ID, and a phone number, I think it's in the WhatsApp group. But if you can just send it across again, we will
Hmm.
send you. We'll send you the details there.
Okay.
If you want, someone should visit from our side. We can
Hmm.
arrange that so that we get an idea कि आपका lab space कितना होगा, what is the
Hmm.
budget that we are looking at, and what is the priority list that you want to
Hmm.
first go with. So सबका
Okay.
phase अलग अलग रहेगा. See, someone may think that
Hmm.
no, getting a ALS is the right thing right now, but some other
Hmm.
institute may feel that no, we want BLS first, and we don't have budget
Hmm.
also. So
Hmm.
if we can be more specific and customized to you, आप अपना details share कर दीजिए. We'll get back to you on
Okay.
that. And
Okay.
AMC, we already covered 6 years of guarantee warranty. So either we repair it or we replace it.
Okay. Okay.
Yeah,
Okay.
and that's why we have, at least though we say that we visit twice in a year, but our team is always on the move and we visit quarterly at every
Hmm.
institute and we just check whatever we have supplied so far. Because,
Hmm.
the professors or even the tutors or someone who's handling the skill lab may change, right?
Hmm.
So there's always a chance that if we have taught someone what are the do's and don'ts, next time
Hmm.
we go, they are not there. So there's someone new
Okay.
who's handling it. So
Yes.
these
Yes.
are the service. So we are always on the move, and we can attend to any calls within 48 hours of your registration.
Okay. Thank you, sir.
Ma'am, if I may ask, which institute are you from?
Sir, I am from Murlidhar Ayurvedic College, Rajkot.
Got it. Right. Smita Shetty ma'am was there, but now I think
Dr.
someone else.
Prajakta Tomar.
Got it, ma'am. Definitely we can visit.
Yes, sir.
any more queries? So I assume there are no more queries. If anybody wants to speak, you can raise your hand maybe. We will be sharing the catalog details, the website details, and even the inquiry form link on the on the WhatsApp group. So kindly don't leave the group as of now, because there is a lot of information that is going to pour in next few days. So do stay tuned for upcoming information. So okay, so Supriya ma'am has a question regarding training.
So Supriya ma'am, what kind of training you are looking for?
Ma'am, can you raise your hand? I can just unmute you and. Ma'am, can you just put a little bit in detail about what exactly are you looking for? Training.
Supriya ma'am, can you please elaborate what kind of? Ma'am, can you please elaborate what kind of trainings you require? Because we have a wide range of trainings. We used to train the training of trainers program. We have a competency-based skills for the students also. So we used to provide a different competency-based trainings and training of training programs. So if it is possible, you can send us a query what kind of trainings you are looking for. So it will be easy for us to give you the answers. Ki, okay, this is a training which you want from in your college or in your center.
So we can wait 5 more minutes if there are any more queries, or else we can drop. You can also mail us to the given mail IDs. Okay. Thank you so much for your time and interest in the in our event. Do stay tuned on the WhatsApp group for more information. Thank you so much.